The most important natural health secret. The study of natural health has been founded on one foundational principle which has largely been forgotten. We've already discussed your body has 4 channels: bowels, defecation, kidneys, urination, skin, perspiration, and respiration to eliminate the poisons and toxins from inside you. The most important of these 4 channels to eliminate from is the bowels. Most people's insides are so dirty that they're like a sewer. We say, death begins in the colon. Most people are filthy inside. It doesn't matter if you're fat or skinny, or if you're looking to lose the last bit of weight. In the attachment is a picture of how a healthy colon should look, and a picture of how your colon probably looks. You smelt the overpowering smell on occasion from opening your bowels. That's because you have muck that can sit in crypts and pockets in your intestines that can stay there for months or years. You also have an amount of encrusted fecal matter stuck to your intestinal walls. As this foul-smelling sewage sticks to your intestinal walls, it soaks through these walls into your bloodstream and creates an environment constantly where you're poisoning yourself with toxemia. Now your bloodstream, in addition to your colon, is toxic. Once this happens, microorganisms such as parasites and worms set in. You probably have worms inside you. They spontaneously appear to eat all the impacted muck inside you so your intestines don't explode. Your body has an infinite intelligence to continually restore it and bring itself back to a state of balance. If you break your arm, your body heals it. If anyone has any medical condition, this is where we must start to allow your body to muster the resources to heal. The greats in natural health have always believed that the cause and cure of 90% of all health conditions, no matter where they were present in the body, begins in the bowel. So if you're sick and tired, maybe it's time you clear this out and allow your body to heal. Most people are cleansing, not clogging. Your body is designed for food to pass from mouth to rectum in no longer than 18 hours. We're designed to have 3 bowel movements a day. Most primitive cultures defecate approximately 30 minutes after a major meal. If you open your bowels once every day, only once instead of 3 times every day, after 2 weeks you're already 28 meals behind. Most people's colons are not the proper shape due to the damage we do with what we eat and drink that causes the intestine significant damage. The reason we don't feel it is because there are very little nerve receptors inside your internal organs. Your colon can be impacted with fecal matter, bent, twisted, inflamed, have decaying fecal matter in pockets, and it's not felt. But you do get the symptoms: heartburn, bloating, constipation, diarrhea, irregular bowel movements, colds, flus, acne or other skin problems, headaches, bad breath, impotence, pressure on the ovaries and fallopian tubes, depression, allergies, back pain, fatigue, and weight pain. In fact, many people's transverse colons are so impacted with matter that it drops from the weight, and now fecal matter has to travel up against gravity. Often when the colon gets so impacted, the intestines swirl like a balloon to allow safe passage of fecal matter through to the rectum and out to the toilet. This coping mechanism stops the intestines from exploding. Even when you eliminate regularly, your bowels can still be encrusted with waste products. Frequency is not an indication of anything other than a lack of constipation, because diarrhea is actually another form of constipation. Cleaning your colon can be a rapid way to lose weight. We often say in natural health that the average person has 7 kilograms or 15 pounds of impacted fecal matter inside them. I personally detoxed patients who after a series of bowel movements had lost over 10 kilograms in one evening, or who after a series of enemas in one sitting have lost 5 kilograms. Don't be deceived if you are thin. There's still a significant amount of fecal matter inside you. There are some famous people who have had dysfunctional colons. John Wayne and Elvis Presley are 2 very famous examples. John Wayne had bowel surgery as his 3rd surgery before he died. According to his autopsy, he had 77 pounds or 35 kilograms of feces in his colon when he died from cancer. I believe he would have been better off having bowel surgery as his 1st surgery. It's well known Elvis Presley suffered a year before he died with an enlarged and obstructed colon. According to the 4 doctors who did Elvis's post-mortem, they said, and I quote, "The colon is approximately 5 to 7 feet in length in a person Elvis's size and should have been about 2 inches in diameter. However, Elvis's colon was at least 3.5 inches in diameter in some places and as large as 4.5 to 5 inches in diameter in others. The megacolon was jam-packed from the base of the descending colon all the way up and halfway across the transverse colon. It was filled with white chalk-like fecal material. Vitamins and minerals don't keep the colon clean. Anyone who prescribes vitamins or minerals initially is not using the most basic premise that the field of natural health is founded on. A competent natural healthcare practitioner will start cleaning the colon before or while they do anything else. A cleaner digestive system means you absorb more nutrients from what you eat. Remember, it's not what you put in your mouth, it's what you assimilate. There are several strategies to keep the bowel clean. Number 1, use herbs that flush the colon. Generally, the first place to start is herbs that assist your colon to empty what is inside you. Herbs such as senna, cascara, and rhubarb are commonly employed for this. Other strategies sometimes employed are Epsom salts, which is magnesium sulfate, which helps the bowels relax and empty their content, or sea salt. Flushing with sea salt, however, can tend to be quite harsh to the body. If someone's bowels aren't moving strongly by themselves, herbs may need to be administered after a detox to improve intestinal tone and strength. Psyllium and slippery elm are two things that can be used for this. And please be aware that psyllium is generally constipating to most people, so you'd only do that once you begin to get your bowels to move strongly by themselves, or if you already have a tendency towards diarrhea. The second strategy is enemas and colonics. Dr. Bernard Jensen, considered the greatest expert in history and bowel care, at the age of 73 recalled, I quote, "When I was training with Dr. Glenn J. Sipes, we received a phone call from a young man 26 years. When we arrived, he was red as a beet and oozing liquid from his skin. He had extreme pain throughout his whole body and a very high fever. Dr. Sipes tapped the man's bowel with his fingers and asked when he last had a bowel movement. The young man said he couldn't remember. Dr. Sipes went outside and cut a piece of reed 2.5 feet long. He cleaned the reed out, took some warm water and blew it into the rectum, causing the man to eliminate. The procedure was repeated over and over again for an hour. In an hour and a half, the man's fever had completely dropped to normal. There was no more redness of the skin and no more pain in the body." Enemas can be done with bentonite clay or dissolved organic coffee. The coffee can be dissolved by boiling the coffee and then returning it back to room temperature. Do not put excessively hot water inside your intestines, as they're sensitive. As organic coffee is quite strong, it's recommended to not be used long term. An enema kit can be ordered from any pharmacy online. You may like to put chlorophyll and or sodium bicarbonate in your enemas as well. Skin conditions are often treated through the bowel. Currently, most skin conditions are masked with a steroid such as cortisone or prednisone. But let's look at some successful models of people who have fixed their skin conditions, even when the skin condition was so severe that it afflicted the person head to toe. One famous example was the American father of iridology, Dr. Bernard Jensen. He would take people to his ranch and treat them with enemas and natural food. Dr. Jensen was passionate about studying cultures whose inhabitants seemed to have the most longevity on Earth. After achieving worldwide fame in his lifetime, he originally coined the term "death begins in the colon" and was famous for treating incurable patients. You need to detoxify from the liver, after the bowel, or while the bowel. But the liver is not the first place to begin unless you detoxify the liver in conjunction with a bowel detox. The liver can be thought of as the filtration plant for your bloodstream. It filters poisons out of the blood. Alcohol is the most common poison we associate with liver cleaning, but it doesn't end there. Your liver filters out over 1,000 different poisons from your bloodstream. Once your liver filters these poisons out, it turns them into bile and sends them to the gallbladder for storage. Then the gallbladder sends them outside the body through the bowels. It's important when you detoxify to send the muck somewhere, and a detox that does not open your elimination channels, primarily the bowels, is not a detox at all. It's important to eliminate from the bowels quickly. When undergoing an elimination program, it is important to eliminate as rapidly as possible so your body does not reabsorb the toxins, leading to nausea, headaches, joint aches, and foul-smelling breath. We aim to get people opening their bowels 6 to 10 times a day or more when on a detox. Many people comment, "The smell was the worst thing I could ever imagine, like a decomposing body." You can imagine the sort of damage that this was doing to you before you went through the process of elimination.